8 to 10 years ago, RPA became convinced as an organization that performance measures were the key to quality improvement in healthcare delivery. That was the beginning of our interest in performance measures. Early on, it was solely directed towards quality improvement, and then as quality improvement evolved, safety became an important part of that, and accountability became an important part of that. But it all began with quality improvement. If we can't measure quality, we can't improve it. The performance measures fall into one of three categories, and two of the three are very important. One is outcome measures, and that looks at what actually happens to patients. The other that is very important from our perspective is process measures. And process measures are what we as practitioners do to patients. And that's where we think we can have the greatest impact on improvement of healthcare, in improving process. Practitioners have control over process. They don't always have control over outcomes. In order to improve patient outcomes, we have to improve practitioner processes. And in order to do that, you have to know what to improve. And that's where measures come in. If you can measure the things that practitioners should be doing, compare them to evidence of how they should be doing it, you can then find opportunities for improvement. And then by intervening in some way, whether it's education or some other way, and comparing measurements before and after that intervention, you know whether or not the intervention has been successful. And if it's not, then you go back to the drawing board and try to find some other way to intervene to make it successful so that processes improve and outcomes improve. Nephrology in general is at the cutting edge of all of these issues because we have a very rich, robust, and long-lived national database for people with end-stage renal disease. So we really understand a lot about outcomes in that patient population. Given that as a background, it's also easy to determine what areas need improvement. And with that, because RPA interfaces and represents the national nephrology practitioners, we can take those opportunities for improvement and pass them on to our membership. It's our association's obligation and opportunity to improve care. I think we understand better than anyone else what it's like to live in the trenches, in the interface, the immediate interface between patients and practitioners. I don't think there's any other organization that understands that quite as well as we do. Very early in the process, long before we think any other organization took an interest, we began writing white papers about what performance measures should be, what the requisite parts of it were, how to make performance measures actionable by the practitioner. So early on, it was an intellectual process. Rather rapidly, however, we applied that information to national ESRD patient safety initiatives, to the National Kidney Disease Education Program. The RPA has been very involved nationally with partnering with other organizations and leading efforts by other organizations to develop performance measures for patients with chronic kidney disease and end-stage renal disease. In addition to the National Kidney Disease Education Program, RPA is involved with commenting on performance measures that are developed by the National Quality Forum, which is a very large consortium of community and private interests in improving healthcare quality. RPA has taken a lead position with an organization called the Physicians Consortium, which was originally organized by the American Medical Association and has now become a somewhat independent organization representing the entire house of medicine. In that organization, we are developing performance measures for patients with chronic kidney disease and patients with end-stage renal disease. It's our hope that those measures will be utilized to improve the quality of care to those patients and perhaps to be utilized by governmental agencies for helping us become accountable for our outcomes and also for improving our quality of care.